Hello and welcome to Community Storytelling. I'm Lissa Kreisler, and I'm so excited to be sitting next to this man over here because I don't think I've ever met a man with such a resume before. So we have Dr. Robert Pearl, but I know your friends call you Robbie. Is that okay?
That's okay, Lisa. Absolutely.
Somehow Robbie, though, won't go with everything I'm going to say about him. Let's see if I get it all right. Okay, went to Yale, went to Stanford, plastic and reconstructive surgeon.
Fix kids with birth defects, cleft lip and cleft palate.
All right, all good stuff, not just, making yourself look prettier. Let's see, not that there's anything wrong with that. Let's see, professor at Stanford.
Business school and medical school.
Business school and medical school. Former CEO of Kaiser Permanente Medical Center for years and years and years. How many years?
18 years.
18 years. That's for years and years and years. And I also read you are one of the top 50 physician leaders in our country. Did you know about that one?
That's what my healthcare said. Yeah.
Okay. And you wrote a book.
I wrote a book.
You wrote a book. In fact, it's right here. Bestseller. Mistreated. Let's see. Mistreated, but it's got another subtitle. Mistreated. Why you think you're getting good health care, but you are usually wrong.
Pretty close.
Pretty close. What is it?
Why we think we're getting good health care and why we're usually wrong.
So when did you even have time to write a book?
I wrote it between 10 p.m. and midnight and between 4 a.m. and 6 a.m. for about 14 straight months, every single day.
So a lot of research obviously went into this book.
A lot of research, but it's also my background. I mean, having run the nation's largest medical group, the Permanente Medical Group, on both California and the East Coast. I was the CEO in the Mid-Atlantic, Washington, D.C., and Virginia and Maryland, as well as in California. Almost 5 million members, 10,000 physicians, 35,000 staff. I had a lot of experience. And so much of the book is my own experience in medicine and then my research in the psychological background behind the contradictions that we'll talk about hopefully in a few minutes.
So, it's funny. I mean, about Kaiser, you either are a member or you have a best friend who's a member. I mean, everybody knows Kaiser.
50% market shares, that's exactly the statistic. Half of the people are, half the people are not.
There you go.
Left house, right house, one's a member,
there
one's
you go.
not.
And you practiced there too, I assume, before you became CEO.
Oh yeah, absolutely. Yeah, I continued to practice actually as CEO, but actually way scaled back, just so I could know what's going on. What's happening in the operating room? What are patients saying? But yeah, I did a lot of surgeries, as I said, particularly around children with birth defects, and a lot of international trips doing volunteer surgery.
Are you involved with Doctors Without Borders?
I'm involved with them. All the profits from my book go to Doctors Without Borders.
Really?
It's a charity that provides relief across the globe.
Yes.
Actually, right now, it's very involved in parts of Africa and Asia. And it's a tremendous organization. I encourage everyone to think about them if they want to make global relief donations.
Well, there you know, buy the book. And already you're making a contribution.
It's available right through Amazon.
And I haven't even mentioned you live in Los Gatos. We'll get to that too.
Okay.
But healthcare. And, we all live healthcare. Whether or not we talk about it, whether or not we're sick, healthcare is our life. And it better be our life, otherwise we don't have a life, right? And it's such a big issue right now. Not even talking about the insurance issue, just medical care. I've always said to my kids, I have 2 daughters, and I've always said, you have to be an advocate for yourself and your family, because if you're not your own advocate, you're in trouble. Can we start there? Is that true? Is that a true statement?
I think it's true, but a lot of the book is about the fact, even if you're a great advocate, there's so much you can't do. As you know, I start the book with the story of my dad.
And talk about your dad.
So my dad was an amazing individual. He was the son of 2 immigrant parents, worked his way through college and dental school. In World War II, he could have stayed safely behind American lines, but he volunteered for the 101st Airborne, parachuted on D-Day.
Oh.
He and his troop were captured by the Germans, 2-day escape through the forest at night, but everyone back safely. What Tom Brokaw would call the greatest generation.
Absolutely.
He lived in New York half of the year and in Florida half of the year. My brother, who's the chairman of anesthesia at Stanford, I picked his doctors. I mean, he had the best doctors in the world. Oh. And one day, he got very tired, and he had a diagnosis made of what's called a hemolytic anemia. His own body's breaking down his red blood cells.
How old was he at the time?
I'm going to guess that he was probably in his 60s at that time.
All right.
And he had to have his spleen taken out. And when your spleen's taken out, which solves this problem, you're susceptible to a particular infection called the pneumococcus. Now, his doctors, who were excellent doctors, all knew he needed a vaccine. But the ones in New York thought Florida Florida thought New York. Primary care was sure specialty care given it to him. Specialty care was sure primary care. And in the end, he never had it. Came out to visit my brother and me. Dinner at my house, went to my brother's house. My brother finds him on the floor the next morning, 5 a.m., unresponsive. Takes him to the ICU at Stanford. 4 days unconscious, 3 weeks in the hospital. He doesn't die then. He'll ultimately die as complications of that. And the diagnosis? Pneumococcal septicemia. One of 200,000 people in the United States who die every single year from preventable medical error.
How many? You said 200,000?
200,000 every year.
And none of these doctors who are caring for the 200,000 know about this?
Well, think about it. How does doctors in New York know about Florida? They don't share a common electronic health record.
Yeah.
They don't work together as one. I mean, sure, he had 9 different physicians across his medical care. Are they all going to get the information? I mean, how did my brother and I know that he hasn't had this? We're not going to call up and say, did you give him the pneumococcal vaccine? There's all these other pieces, and that's what's broken. It's not bad doctors. Doctors are great. They're working incredibly hard. It's a broken American healthcare system. I think of it as a 19th century cottage industry. Fragmented. Doctors scattered across the community, uncommunicating with each other.
Right.
Paid on a piecemeal basis. It's called fee-for-service, not value-based. You get care you don't need, the doctor still gets paid. He has a complication, or she has a complication, they can still get paid as a and the technology, it's 50 years old. You'd never, ever have financial investors where they said to you, you can have your information released at any time you want it, Monday to Friday between 9 and 5.
Yes.
Right? Or I'll fax it to your house. You want to go online.
Right.
You'd never fly an airplane that didn't let you book your appointments online.
Right.
Everything else in your life. And medicine is almost unavailable outside of organizations like Kaiser Permanente. What we have in medical care is so much less than the rest of our lives, and we don't really notice it. And that's what the book is about. It's the gap between objective reality and subjective perception.
Now, this pneumococcal virus, do you only need it if you got your spleen taken out? Because everybody's going to be calling their parents and saying, do you have a pneumococcal virus vaccine?
No. Everyone over the age of, I think 60 it is, should have it because you're particularly susceptible. But if your spleen is taken out, now you're really susceptible. And everyone should have it, as I say, who's over that age, but as well as anyone who's had their spleen taken out.
So I need one now.
You need one.
I need one now. Now I got to go to the pharmacy. Does the pharmacy give them out?
But
like flu shots.
They do, but why wouldn't your physician, and I don't want to ask who it is, know all of that? And that's, again, what the book's about. We focus as a nation on intervention. We worship people who can take blood clots out of the blood vessels going to the brain after a stroke starts. But how about prevention? Across the United States today, hypertension, the number one cause of strokes, controlled 55% of the time. The best organizations, 90%. That's a 40% added chance of a stroke. Or colon cancer. Colon cancer screening. You don't need a colonoscopy, by the way, unless you have a family history or multiple polyps. You could have a fit test, 5 minutes, once a year, privacy of your bathroom, no prep, and yet across the country, it's about 60%. Again, the best organizations are 90. Half of deaths from colon cancer every year are avoidable. We just don't value it. And that's what mistreated, why we think we're getting good health care.
Yeah.
But we're usually wrong because so many pieces are simply skipped over.
You know, talking about online, I go to PAMF. You mentioned Kaiser, I can mention PAMF, I guess. And everything is online. And the last time I was there, she's looking up on the computer. She knew every single medicine I'd been taking. I said, how do you know that? She says, it's in the system. She knew what I picked up at the pharmacy. Are you still on this? No. And the fit tests, they send those out.
That's right.
They
So
send
the
those
organizations that have invested in a large comprehensive system, and the Sutter folks have and the Kaiser folks have, now that information is going to be available every place. But the physician still has to pay attention and say to you, you know, the time has come to get your vaccine. The time has come to get your colon cancer screening. Your blood pressure is not fully in control. Let me get someone with some more expertise that I have to help take care of it. Those are the kinds of things that we should be doing so we can prevent the problems. And I believe strongly, using modern technology, video could replace a third of what we do in the office today without you having to miss work, drive through the traffic, and all the other pieces are there. But we don't do it. Why is that? Because in a fee-for-service world, it's not reimbursed.
So a lot of people are always worried they'll move to a small city. They're not in the big metropolitan area anymore. And they say, oh my God, I got to go to the doctor. I think I have to go back to where I used to live. Does it matter if you live in a small city? You can still get a good doctor, can you not?
Well, I think there's plenty of good doctors in a lot of places. But again, I want to stress the same piece. If you're not in an integrated organization, so a doctor in a smaller town connected to other physicians, other specialists, that care is going to be great. But if they're disconnected, that's when people fall through the cracks. And that's when mistreatment happens. Why 200,000, actually more than that according to Johns Hopkins, die every year from medical error. It's not bad doctors. It's a bad, broken system from my perspective. And it's why I spend time doing Mistreated and how it became a Washington Post bestseller.
And when you say medical error, a lot of times people say, oh, they left a spatula in you, or I don't know, they left something in you. But no, it's often just not talking to each other.
Well, it's more than that. I'll give you an example. I shouldn't tell your listeners this, your viewers this. According to studies, a third of the time, physicians in the United States don't wash their hands between patients at a hospital.
They do on Grey's Anatomy.
They do on Grey's Anatomy, and they all know they should. Because the leading cause of hospital-acquired death is from infection, a particular one called C. difficile. And a lot of the book that I write about, look at it, as you say, research, is how does this happen? And I talk about the Stanford prison experiment. Stanford, where I teach. Yeah? Philip Zimbardo takes normal people. Half of them get aviator sunglasses. They're the jailers. Half of them get OR greens with numbers. They're the jailees. Puts them together to try to find out how do we improve the penal system in the United States. Within 48 hours, the jailers, and I want to use this word very carefully, see the jailees as dangerous, hardened criminals. They make them do debasing things, clean toilet bowls with their bare hands. And the jailees see the jailers as sadistic. They board up the doors. Everyone knows these are just students.
Yes.
But they see them in the context, and that's the problem. When you're in a hospital situation and you're rushed, you start to see yourself as incapable of carrying bacteria. It makes no more sense than the people in the experiment. But that's how you see yourself, and you skip a step. No one can justify it. Tell the physician they're going to harm a patient. They go, oh, no, there's no way.
Right.
But look, someone's doing it. Someone's carrying that bacteria. Every doctor knows it doesn't travel through the air. And that's the point of this book, how context shapes perception and changes behavior, sometimes for the better, but often for the worst.
So it almost sounds like doctors need to be reading this book.
Absolutely. I wrote this book for what I call the patient in all of us. Because, I broke my leg in January. I was a patient. And I was just as concerned that my physicians washed their hands. They all did. But I was very concerned to make sure that happened. And so all of us at some point will be patients. So physicians should read it. People who are not physicians should read it. Everyone should read it. Because if we don't change the American healthcare system soon,
right,
I think it's just going to devolve. And we're seeing it in Washington, D.C. right now. We're seeing it in other places. On my Forbes blog this week, I write about the potential disruptions that could happen, ways that could change. Some of them sound interesting, like technology. A particular company that has a lot of advanced technology that allows things to happen without people. But the other way it could happen is through offshore disruption. And I talk about a friend of mine named Devi Shetty. Devi Shetty is a heart surgeon. He runs hospitals in India, 11 of them. By the way, he was Mother Teresa's doctor, so he's a pretty famous guy.
Yes.
Yeah. You say, Devi, what do you do? And Devi says, I set a value on human life. You say, Devi, what do you mean you set a value on human life? You're a surgeon. I'm a surgeon. I don't set a value on a human life. He says, I arrive to the hospital every morning, and there's 30 moms and 30 babies. They've been well worked up. They all need surgery. I tell them what surgery costs, because in India, only 10% of people have insurance. And it's $1,800.
Whoa.
If they can borrow the money, the baby lives. If they can't, the baby goes home to die. He does a lot of free surgery, just can't do it all.
Right.
He says, if I get the cost down from $1,800 to $1,500, more babies live. I've elevated the value of a human life. And why am I saying this? Because he also just opened a hospital in the Grand Cayman Islands. Have you ever been to, Lisa?
I have been to the Grand Cayman.
Beautiful, white set, right?
It's a wonderful resort area.
He's building a 2,000-bed hospital in an island of 50,000 people. Let me make sure this is clear. It's a 2,000-bed hospital in Los Gatos. It's not for the people of the Cayman Islands. It's a 1-hour plane flight from Miami.
Yeah.
The American healthcare system, if we don't do something about it soon, will be disrupted. And as I teach in the business school, once disruption happens, everyone wants to change, but it's always too late.
So tell 5 basic things that we should think about or talk to our doctor about to hopefully make sure we're not mistreated. Just easiest things.
Well, the first thing is making sure that you pick a healthcare system that has what I call the 4 pillars, the things upon which good care is developed. Is it an integrated structure? Do your doctors work together as one? Every patient assumes that, but it's actually not true. So do they belong to the same group? Are they paid on a prepaid capitated basis? So now they value prevention. So now they value avoiding medical error. They value getting it right the first time. Do they have modern technology? Do they have your complete medical record available to them? Do they offer you the kinds of things like video, secure email, ability to obtain data on your laboratory testing and your radiologic? And is there a structure? Is there someone truly accountable, or is it just vague notion of the quality? And when you have those 4 pillars, that's the first thing that I would say, or the first 4 things I would say.
Okay.
I think that is important. And the 5th thing I would say is that you need to pay attention to your own health. Like you said, you haven't had the vaccine.
Yes.
You know, I don't know whether you've had the colon cancer prevention.
Many times.
Okay, good.
I'm good
good.
there.
All right.
I'm good there.
I don't want you to die from that.
I'm good.
Yeah. So that's what I would say. You've got to be aware of your own health. And those pieces together, when you have a very effective care delivery system and a very involved patient, and you've got to make sure for your parents and for your kids on both ends to make sure that is there. Hundreds of thousands of people die every year, and it could be someone in your family.
Well, that's a somber note. You're
Yeah.
not ending there.
No.
And so, you know, we all, maybe you don't, but the rest of us all go online for the online doctors. You know, what is it, Web Doctor or something like that.
WebMD.
And then, you know, by the time we're done reading, we all think we're dying.
Yeah.
And I don't know, do you recommend that? Maybe that's the 6th thing we shouldn't be doing.
Yeah, I think there's a reason why doctors go to medical school for 4 years and then spend 6 years in training rather than just doing it online. I think there's some information there that's important to understand. But I also think that it's going to be crucial the care you get inside that delivery system and making it come together. If you have questions, have the right conversation with physicians. Make yourself knowledgeable, but you're not going to make your own diagnosis and you're not going to find your own solution. I think that's hopefully why you've picked the right system. And I'll go through the same pillars: integrated, capitated, technologically enabled, and well-led.
I hope everybody's been taking notes. I hope everybody's been
There's a test
taking...
at the end.
Well, or you just go by the book,
Oh,
right?
that's a great idea.
I had thought of idea.
Oh, what a great idea, Lisa. Absolutely.
See, I'm your new manager.
Exactly.
So-
right at Amazon or at Borders.
Oh, yes.
Or,
Yeah, any book place, I'm sure.
Yeah.
What are you going to do next? Are you working on another book?
So I am working on another book. The next book is going to be called Difficult Decisions on Death, Life, and Sexuality. And it's going to be based upon a variety of people that I've met through the medical world, so there's a medical connection, who have had to make choices about whether to live or to die for themselves, for their children,
Yes.
for others. It's about people who have dedicated their lives to making the world better. People that I know who have traveled to Liberia in the heat of the Ebola, and I say the heat because it's 110 degrees, had to have IVs while they're taking care of the patients because they're sweating so much and losing liquid. And people who have had to make tough decisions about gender. And these pieces together, I think, weave an interesting story because all of us struggle with this. Our whole lives about death. It's always an ever-present notion. About life. What are we going to create for ourselves across time? And who are we as sexual beings?
Wow. And how long is that research going to take?
So I'm doing interviews.
Yeah.
All the interviews, the last interview was about 100 pages long of transcribed notes with about 10 different groups, still trying to figure out some of them. As I said, I have one individual who's actually had assisted suicide. I knew him well. He was a surgeon operating on me, whose wife I interviewed for quite a bit of time. Another individual that I knew well who reported to me, a very senior person who underwent a sex change operation from a he to a she. Someone whose child had a kind of very severe problem, had to decide whether to let the child live or to die. Someone who's donated a kidney to a stranger. And I'm hoping to talk to someone who had a face transplant and a whole bunch of other fascinating people and weave it together into a book on how we make very difficult decisions in our life. Because I think it applies to everyone else. These are the extremes. But I think the kinds of ways they view things. You know, when is life not worth living? And when is it worth doing something? I interviewed a girl who was diagnosed with 2 malignant cancers at the age of 17, one in the colon, one in the brain. She's had like 15 different surgeries. And how does she make these choices? And I think it's fascinating to me, and I don't tell you too much about the next book, about how she was willing to go through almost everything, but not a colostomy, because she had seen her grandmother.
Yes.
And so how we make these difficult choices that are sometimes rational, sometimes irrational, but they make total sense to the person. And I think that's the nature and the beauty of life, and I hope to capture it in this next book.
Tell her to call me. She'll go after she talks to me.
Oh, good. Excellent.
And you work on this 10 p.m. to 6 a.m.
Yeah, well, now that I'm no longer the CEO of Kaiser Permanente.
You have more time.
Yeah, I spend almost full time speaking. I had 14 major talks last month, 26 airplane flights. This month I've already had 4. We're only in the early part of November, and also working on the book. So I'm spending probably working more hours than I worked even when I was CEO.
And I was going to ask you, what do you do in Los Gatos to enjoy yourself, to have some time off? What do you do?
So I run. I ran
run.
today at the Los Gatos High School track. I went 5 miles today. That was a lot of fun. I still have a lot of friends here, and certainly my family, my 2 children.
You got favorite restaurants?
Well, everyone's favorite is Man Race. I hate to say it that way.
Well, I'll go if you pay.
I see. Charge it to the studio, Lisa.
Okay.
Come on.
Oh,
I'm sure the studio reimburses that.
Yeah, but everybody loves Man Racer. But yes, if you pay, I'll meet you there.
Excellent.
I'll meet you there. Well, you are just, I could talk to you forever, but I'm guessing you have to get on the plane to go to another interview. Unbelievable. But you look good.
Thank you.
Yeah, you look good. You look refreshed.
I'm totally happy. I'm very, very fulfilled. As I said, this was a bestseller. My claim to fame is I got ahead of Condoleezza Rice on the Washington Post bestseller list. But it is. I really want to touch American healthcare. Kaiser Permanente, 18 years ago when I became the CEO, it was good, but it was not outstanding. The most recent report's #1 in the entire nation. 1,000 programs looked at by the National Committee for Quality Assurance, and is ranked #1, Kaiser Permanente in Northern California, and #2 in the nation was Kaiser Permanente in the Mid-Atlantic. So I feel very proud of what I've accomplished, about the lives that have been saved, about the technology that's been put in place, and now I want to apply that to the whole nation, because why should it be only for 10 million people, 12 million people in the United States today? Why shouldn't it be the way that everyone gets health care? It's my new passion. I love passion. I'm pursuing passion. And hopefully everyone will buy the book, everyone will read the book, and I welcome any feedback people may have, all your viewers, both in Los Gatos and Monte Serena, as well as across the entire country online.
And can we send you to the White House for a few days?
I spend some time there occasionally.
Okay.
I don't talk to the president very often, but I do spend time with Congress and with the staff trying to advise on how we can move from where we are today going forward.
You are an amazing, amazing individual, and you're trying to make us all better and live longer.
The whole nation. The Commonwealth Fund recently published a view of healthcare across the globe. We're 50% more expensive than the next expensive nation. In fact, we spend more on healthcare in the United States, twice as much as all of Europe spends on a population twice as big. So that's 4 times factor sitting in play. And yet of the 11 industrialized nations, we were last, dead last. Life expectancy, childhood mortality, there's not an area that we dominate. And it's this gap between objective reality. The American healthcare system is not the best in the world. There are things it does exceedingly well, but there are a very small number of things. Overall, we skip steps, we avoid prevention, we have complications. The time to change is now, and it's really, I wrote the book for the patients and all of us, Mistreated, why we think we're getting good health care, and why we're usually wrong.
We need more Dr. Pearls in our world. That's what we need, or at least in our country.
It's a scary thought, but we'll see how it goes,
And
Lisa.
I'm going to go make an appointment for my
pneumococcal vaccine.
I'm getting
there
one.
There we go. Excellent.
And I'm going to say
Thank
Dr.
you.
Pearl sent. I'll say Robbie sent me.
Say Robbie sent me. They'll know who I am.
I'm sure they will. Oh my goodness. Remember this man. Get the book Mistreated, because also remember your contribution for that book is going to Doctors Without Borders. No finer organization. You are wonderful.
Thank you, Lisa. You too.
Oh, my
it's been
goodness.
fun. Too much fun.
Yeah, community storytelling. How about that? What a story that is. I got to tell you, I love this gig. Where else do I meet the kind of people I do? Dr. Robert Pearl, Robbie, now that we're friends, now that I know he likes Manresa. But what a fabulous, fabulous time with Dr. Pearl. What about you? Do you have somebody that you need to nominate? Maybe it's you. What an amazing story. And that's what this is all about. Everyone has a story. What's yours? You can nominate yourself or somebody at kcat.org. And I got to thank you so much for joining me and joining Robbie here at KCAT TV 15.